Good evening, I am Peter Thorne, and tonight we bring you a Newsnight special on the COVID-19 shutdown with some very special guests. They are, on my right, the Honorable Attorney General, Mr. Dale Marshall. Welcome.
Thank you. Good evening.
Next to him is the Health Minister, Lieutenant Colonel Jeffrey Bostic.
Good evening.
Welcome.
Thank
Next
you.
to him is the Chief Medical Officer Acting, Dr. Anton Best.
Good evening. Great to be here, Peter.
Pleasure. And next to him is COVID Czar, Mr. Richard Carter.
Good evening. Good evening, Barbados.
We are going to go right into the discussion. Lieutenant Colonel Bostic, what is the count at the moment for those testing positive from corona?
Let me report that last night we would have tested 26 persons, and out of those 26, 2 persons tested positive for COVID-19, which brings the number of persons or confirmed cases to 26 for today.
Okay, and overall, how many persons or people have been tested in Barbados?
The figures for testing up to last night would have been 233.
233. And more testing obviously took place today.
Testing continued today and will continue every day until we are able to arrest the situation.
And the testing for today, when will you be updating the nation on that?
That will come sometime tomorrow.
Okay. At this hour, has there been a need for any of the victims to be ventilated? If not, do their conditions remain mild to moderate?
So if I may take that, yeah, first of all, we prefer to refer to them as patients as opposed to victims. Out of the 26 persons that have been diagnosed over the last 10 days, all of them are still in isolation, and none have been ventilated. The majority of persons are mild, and some we are closely keeping our eyes on.
Okay, no problem. Next to me is the Attorney General, AG, an island-wide shutdown except for essential services. The government went to Parliament today, Emergency Management Act, and there was a lot of debate. I listened to it intently. Arguments saying that under the special powers vested in the executive or cabinet, the Emergency Powers Act, the health services, communicable, notifiable regulations, the Governor General under the state of emergency could refer to other public calamity in place since 1969. But you brought, Barbados has its unique way of doing its business, and you brought this legislation to the Parliament today. You're satisfied that you'll be able to achieve the objective that you're setting about to achieve?
Well, first of all, I'd like perhaps to say that there's been more debate outside of the House of Assembly on the matter of the shutdown than there was inside of the House of Assembly. And I don't think that's a bad thing, and hopefully our visit with you tonight will help us to clarify some issues and to clear up some of the burning questions. But I think that we need to begin with the government's approach to this whole COVID-19 issue. The government has always had, from the time of our Constitution, the power to declare a state of emergency under our emergency powers legislation and under the Constitution. Those powers are not so much different to the ones that we are looking to exercise in part today, but the Emergency Powers Act speaks to a state of utter disaster and a situation where a country is trying to avoid all out anarchy and chaos. It's not just a matter of semantics. When we began the process of dealing with COVID-19, we took an approach to it that was systematic. We tracked every possible option that we had within our power, and it was clear to us then, and is to us still now, that we were exercising powers of management. Management is more than just a knee-jerk reaction. We've brought on the kind of people that we need to bring on, people like our Czar, Richard Carter, who has experience with Ebola, which is perhaps 1,000,000 times worse than COVID ever could be. And therefore, we took the view then, and we think it's working for us, that we will manage this situation, and that the best place to locate the powers that we needed would be under our Emergency Management Act. If we have a hurricane, we don't go to the Emergency Powers Act. We locate our state response under the Emergency Management Act. and we felt it was entirely appropriate to extend the ambit of the emergency management legislation to include public health emergencies. And I have to say that it probably was an oversight at the time when we passed that legislation. When the Barbados Day Party was last in power, that we didn't include public health emergencies, but we think that it's the appropriate strategy to adopt.
AG, walk us through the businesses that can open while the island remains under a public health emergency from Saturday, March 20th to April 15th, the day after Easter Monday.
Yes. Well, let me begin by reminding all of Barbados what this mission is all about. It's about preventing the spread of COVID-19. And if you begin at that position, the rest of it follows more or less logically. We know that COVID-19 is spread by human-to-human contact of one sort or another. And therefore, there's no doubt, and I'm reliably advised by Dr. Best and others, that the way in which we are going to be able to stem the spread of COVID-19 is by reducing drastically human-to-human contact. In England, they have determined that no more than 2 people can gather outdoors. The United States has locked down, New York has been locked down. I think the statistic is that around 1/4 of the countries in the world, or 1/4 of the world's population, is in a state of lockdown. So that is all based on the notion that keeping people apart is the way in which to prevent COVID-19 from spreading.
But we are seeing, AG, long lines still at supermarkets, outside banks in Barbados. I looked at them today, not observing the social distancing measures of 6 feet. And they say that for every person that is infected, we have 26. They infect about 2.6 others.
And we need Barbadians to be responsible and to recognize that, look, I think that Caribbean people are touchy-feely. They get close to each other. That's just how we are. We're friendly, we're warm. But at this point in time, those things that are so intuitive to us need to be pushed back. Now, we know that some enterprises are trying, but somehow or another it is hard for a Bajan to see another Bajan and not want to walk up and make a conversation. That is how we have always been from perhaps time immemorial. But people have to be responsible. People have to understand that distancing is not about being antisocial. Distancing is about preventing the spread. But if you could let me come back to where we were going. So in order to prevent the spread, we have to limit human-to-human contact. We've closed the schools, so the teachers are not at school, the students are not at school. Our next step, therefore, has to be to tackle businesses. Now, I think there was the misconception that there would be a curfew, but that somehow businesses would continue as usual. Not at all. We want employees to stay at home. We want customers to stay at home. We want businesses to close. And therefore, under the regime that will start on Saturday night, let's begin from the fundamental. All businesses, with a few exceptions, are closed. Plain and simple. All businesses are closed. Of course, the state still has to be able to provide essential services. Police still have to work. The defense force still has to work. All of the medical personnel, paramedical personnel, they still have to have responsibilities to the state. So there's a whole raft of activity that has to continue. We can't function without it. Those things we loosely define as essential services. Water authority, the production of water, the maintaining of our electricity network, the maintaining of our telecommunications network. It's a long list, I can go through it for you, but that's the basic concept. Those things that are absolutely essential to our existence must be allowed to continue, and those are what we call the essential services. Now, and this is where much of the discussion is happening. Having decided that all businesses close, we also consider it important for Barbadians still to be able to live as human beings and have some minimal functionality as citizens. And it is for that reason that we begin with what are the necessaries. Food is necessary. And therefore, much of what we have exempted is intended to permit Barbadians to access food. If we had a system, if we implemented a system which prevented grocery stores from opening, you just imagine what kind of pandemonium we would have on the streets now. Just a few days back, we didn't have any shutdown, but there was a rumor of a shutdown coming, and every place was crazy. Gas stations, supermarkets, everything. So the exemptions, you will notice, are pretty much located around food and necessary supplies. Abattoirs, butcher shops, fish markets, they provide our protein. And that's an important thing for us. And therefore, we're allowing them to continue. But I think you had a question.
No, I mean, for example, people ask what the day-to-day person would ask. Can hotels still open and offer restaurant services and spas, etc.?
Hotels are going to be allowed to open. Hotels have guests. And there are still people in Barbados staying in hotels. So we've taken a decision to allow hotels, villas, and rental accommodation to continue their business. However, you mentioned restaurants and so on.
Restaurant
All
services.
those hotels that have spas and gyms, lawn tennis courts, golf courses, hairdressing salons, masseurs, all of those ancillary recreational facilities have to be closed off. So a hotel can remain open purely for the purpose of housing a guest, but for no other purpose. The restaurant in the hotel, if it has a restaurant, the kitchen will be allowed to open only for the purpose of in-room dining, in other words, room service. But beyond that, it would not be able to operate insofar as guests are concerned. Generally, restaurants are going to be allowed to open within specified hours, but only for the purpose of takeaway. So McDonald's, Burger King's drive-through, that's fine.
So tomorrow when Barbadians seek to enjoy their pudding sauce, what
Not
should we do?
tomorrow. Tomorrow is fine. Tomorrow is the last mass for putting us out.
Okay, okay.
At a sit-down location. You'll be able to do what all the many Bajans do, buy it and take it away.
Okay.
So we're not stopping what the old people call cook shops from operating. We're not stopping our pudding and sauce vendors, but you buy it and you take it away. And I think that's the norm in the food industry now all across the world, isn't that right?
And hardware stores.
Not opening.
But if they have to be involved in, like, say, we are still trying to ready the Harrison Point facility.
And that is an exception. That is an exception. Harrison's Point facility is vital to our fighting COVID. It's our quarantine facility and our isolation facility. And therefore, it has to be finished. And it's probably about a week or so behind schedule, but we are confident that it will come in another week or there.
I'm here next Saturday, Lieutenant Colonel Bostic. Is that correct?
That what? Sorry?
I'm here next Saturday. It's likely to be ready.
I am not going to give a date. I can say that we are aiming to have it ready within a 2-week period, recognizing the fact that there's some important equipment that has to come in from overseas, and there are some challenges there, but we're doing everything possible to ensure that within a 2-week period that the facility is up and running.
Okay.
But the point I'm making is this. Harrison's Point must finish. And therefore, all businesses in that value chain will be exempted for that limited purpose. So the contractors who are working at Harrison's Point, they'll be exempted for that specific project. The subcontractors, the same thing. The suppliers, the same thing. So if a contractor or subcontractor at Harrison's Point needs items from a hardware store, we'll be permitting that hardware store to open its warehouse, to fulfill the order, and to have it delivered to Harrison's Point. But other than that, the hardware store will not be open to the public. Now, it's probably uncomfortable for most people, but we feel that at this early stage, and I should perhaps let Dr. Best explain the rationale. He can do it better than I. But now is the time to take these drastic measures when we still have an opportunity to contain it.
Because I contend that despite the fact that we are 26 cases, my mantra is that the virus isn't spreading. People are spreading the virus. I think that is an essential message that we have to get across. But before I'm going to Dr. Best and Czar, credit unions and banks and transport board buses and PSVs.
So, credit unions and banks are vital to our economy. People need to be able to access funds. There's no doubt about it. And therefore, it would have been unwise of us to prohibit banks from opening. If you're going to allow banks to open, then it's obvious that we're going to have to extend the same thing to credit unions, because there are a lot of Barbadians for whom credit unions that's the source of their savings and so on. So credit unions and banks are going to be allowed to open between 9 and 5. Now let me make it clear. When we say between X hour and Y hour, we're not saying that a credit union or a bank or a butcher shop or a bakery has to be open at that time and has to close at the outer time. What we're saying is that those are the outer limits of the institution. So when we say credit unions and banks should open between 9 and 5, we're saying that, first of all, we expect banks and credit unions to be responsible corporate citizens. Part of that is a responsibility to scale back and have skeletal operations. Part of that may also be a narrowing down of the opening hours or restricting of the time that people can come in and do business. But we expect them to do that as a part of helping us to fight COVID. But we are saying that and we will not allow you to close later than 5. So a bank can determine, well, we're going to open at 10 and serve customers at 12, and we close at 2. Sorry, they could say we close at 2. Those hours we leave to them, or that the quarantine is respected.
Yeah, Jason, I have many more questions for
That's
you, but
fine.
I'm going to involve the rest of the panel.
Please.
Dr. Best or the Health Minister, can you give us an age range of the persons affected so far by the coronavirus?
So if I may, out of the 26 cases that we've had so far, 12 are men and 14 are women. And the ages range from 20 to 76.
Wow, 20 to 76. I want to ask, I know that we are waiting on medical supplies and equipment to assist us in combating this virus. Can you give us an update as to how soon these are expected to be on island?
Well, a lot of the equipment that you have referred to a lot of that equipment is on order. But we have actually started to receive equipment coming from various sources, equipment as well as medical and pharmaceutical supplies. So while there's no set time frame for the receipt of items, we are working feverishly to ensure that we get them here as quickly as possible. But you must recognize that there are some restrictions in other parts of the world where we depend on our shipping lines, so that also has a part to play. But we are working feverishly, including the possibility of Barbados actually having some chartered flights to be able to get us our equipment here in a quick time.
Okay. Does the situation, from what you can see, merit that we would have or have you made a formal request to, we are hearing about Cuba, to try to render assistance, whether it be medics, whether it be nurses, whether it be the, in terms of drugs? Have you made a formal request?
We have made a formal request. We've actually met with the ambassador for the Republic of Cuba. We've actually signed an agreement in relation to drugs, so that is definitely on stream. And only yesterday, the ambassador informed us that our requests for technical assistance in terms of nurses, that has been approved by the government in Cuba, for which we are very thankful. And we expect that some 100 specialist nurses should be arriving in Barbados as soon as we get that word from Cuba. And we are also requesting some assistance with doctors as well.
Just as a follow-up, we were expecting the Ghanaian nurses to be here around this time. Has the onset of COVID-19 retarded or stopped them from coming over to these shores?
Well, you would, of course, appreciate the fact that Ghana itself is on lockdown for COVID-19, and so there are no flights out at the moment. But we've been in contact with the authorities in Ghana, and we still expect the nurses to arrive. And as soon as they're able to facilitate that arrangement, it is the intention of the government of Barbados to have those nurses flown to Barbados so that they can commence operations in Barbados.
Dr. Besson Czar, it's been revealed all over the world that 1 in every 10 frontline workers are contracting the disease. Britain, they have just announced that from next week, they will be testing all frontline workers. Will we be doing so in Barbados? Since we are hearing rumblings, I've been hearing in the journalistic community from some of the frontline healthcare workers, and I'm sure you have been hearing them too.
Yeah, so what I would explain, Peter, is that it's of paramount importance to focus on the prevention of our healthcare staff. So those working on the front line are a priority for us in the Ministry of Health and Wellness and the Queen Elizabeth Hospital. So that involves training. So persons who would volunteer their services to be in the front line, working in the isolation center, for instance, they would be provided with adequate personal protection in the form of PPEs, personal protective equipment. And those persons are also persons who would have been trained specifically in how to use those equipment. So that's the first thing. In terms of testing of frontline workers, we're not quite there yet. You must appreciate that the scenario faced in the UK and in other parts of the world is dire. And even with the best protection, sometimes there's still a increased risk for healthcare workers. So we are paying very close attention to that, and if necessary, if it is recognized that we need to do testing of healthcare providers, we will do that.
And Peter, I want to come in here particularly because a lot of the discussion around the restrictions that are being put in place focuses on the discomfort that it may cause to a few persons or persons who basically want to continue as they are currently doing. That is an act of absolute selfishness. And we will not allow the safety and security of Barbados to be sacrificed on the altar of the recklessness of a few. And we have seen expressions of this recklessness, unfortunately, among some Barbadians. Persons who've been spreading fake news, calculated to cause fear, discomfort, and distress. Persons who have been leaving quarantine, again, calculated, or perhaps not calculated, but certainly with the consequence of causing potential harm and potential infection to other persons. Persons who are already making a declaration of intent not to obey the restrictions that will be imposed in respect of restriction of movement. And we must really ask ourselves, as Bussa figuratively asked Smokey, is this what we died for? Is this what our Barbadians who have gone before have sacrificed their lives for? Is this what 11 plus years of free education can be most usefully applied to? The use and circulation of messages intended to cause harm and distress among the Barbadian citizens. We have thus far managed this response in a manner that has been characterized by empathy, compassion, and humanitarianism. We have taken cruise ship passengers and allowed them to transit through Barbados at a time when persons felt that that should not happen and would rather have subjected many elderly persons to a 9-day transatlantic voyage. We have taken on citizens or allowed them entry into our country when their own country has refused them entry. We have allowed contacts to be quarantined in their own homes, in the comfort of their own homes. What we are saying now is that those persons, for example, who breach quarantine, because the comfort of their homes becomes so circumscribed that they feel they must leave. We have identified adequate space at a facility in St. Philip where such persons can be kept to protect the security, safety of the nation.
Okay, I want to remind Barbadians that you can call us at, I believe, 228-5562 or 228-5563. And we have our first call of the night. Good evening.
Hi, good evening.
Good evening.
Hi. I just have a quick question. Regarding like courier services, freight forwarders, and companies like that, will they remain open during the lockdown, or?
Let me weigh in on that. You know, I thank you for your question, and it exposes really another issue. It is difficult for Barbadians to consider that, to conceive of a situation where their particular business is not an essential services. As far as we're concerned, everything is essential. We are prepared to waive the restrictions in appropriate cases, but let me tell you what an appropriate case would be. If a courier service has to deal with medical supplies, we're happy to give the exemption. If a courier service like FedEx is bringing in a shipment of PPEs, we're happy to give the exemption. Okay? Those are our priorities. At this point in time, we certainly have enough food on the island to last us a few months. So if somebody decides they're going to order a pack of, I don't know, chocolates on Amazon, we're not interested in that. And I think that it's important to take that particular question further. We have customs, we have people who are going to be shipping in things, and people are saying, well, you want us to leave our stuff stake out at the airport or at the seaport or anything of the sort. Our priority is on keeping Barbadians safe. And in order to do that, we have to reduce the number of people on the road, and we will make exemptions if it relates to vital things. If a freight forwarder is bringing in a piece of equipment that is needed by the QEA, so if they're bringing in ventilators, if they're bringing in something that's critical that we must have before the 2 weeks are up, we will give a specific exemption. But beyond that, I'm afraid there's not much chance.
I want to go back to the question there of the testing of the frontline workers. If this situation lasts about 6 months, and God forbid that it does, we are certainly hoping that it doesn't happen. Is there a time frame that you're looking at whereby that you can achieve this objective to have the frontline workers tested? And I'll take you a little further. In the developed countries, when they're doing now, because they're somewhere behind in terms of that, the testing, kits, whereby the kit can tell you if you were a frontline worker and you had it, but at the time you weren't detected, and that you have developed an antibody for it. Is that the kind of testing you'll be looking at?
So there are two types of tests that we've been talking about. The test that we're currently using uses a technology called PCR. So essentially it looks for actual presence of the virus by looking for DNA of the virus. And that is a gold standard test. The test that you refer to is an antibody test, which is looking to see if you've reacted to the coronavirus. The problem is that this is one of many coronaviruses, and you can get what we call cross-reactivity between different coronaviruses. So there's a high chance of false positives. There's also a chance of false negatives if you're using the latter test, the antibody test. I just want to go back to the point of testing of frontline workers. It would be important if we ever got to a stage where our health systems were so overwhelmed that we then needed to protect the healthcare worker from passing on the infection to other patients, or passing on to other contacts in their environment, such as co-workers and to their family. But Peter, you're asking a very hypothetical question that is extremely difficult to respond to.
Snow cone sellers, roadside coconut vendors, snow cone sellers, fruit vendors, roadside vegetable vendors, itinerant tradesmen, Bed-and-Rest schoolmen, would they be allowed to ply their trade between the hours of 6 and 8 p.m.? And also, in the other countries, we have a breakdown of, for example, New York has these cases, New Orleans has this amount of cases. Why don't you give us a figure of how many cases per parish in Barbados who are now diagnosed with COVID-19. Thank you.
Is there any key? Two important questions with the. You want to take the one with the coconut vendors?
Yeah. Let me say that as we've tried to carve out entities or establishments to facilitate them continuing in business, we recognize we may not have captured everybody. So there are individuals who have been asking, will we allow roadside vegetable stands to sell? Now remember, I've said that one of our important missions is to allow Barbadians still to have access to food. Now, my constituency is in St. Joseph, and roadside vegetable stands are very important to St. Joseph. So there's every reason why those should be exempted. But let me make it clear that we will only be exempting those things that we have to exempt. At this point in time, we've given no consideration to whether snow cone vendors should be exempt. We've given no consideration to whether coconut vendors will be exempt. We always have to consider what is the proximity risk that is associated with these things. I'm happy to discuss it, but I think that there's a proximity risk to a person who is purchasing snow cones, and there's probably a proximity risk to several other kinds of enterprises. I'm happy to consider it, but at the moment, the food enterprises that are open, and I'll just repeat it, wholesale and retail grocery stores, mini marts, village shops, and these are allowed to open between 9 a.m. and 5 p.m.
The other question was, and I'll give one of the panelists there a chance to answer, like for example, in New York and Washington, you have emerging as the major cities in the United States, Lombardy in Italy, Wuhan in China. Any particular parish emerging out of the 26 for Barbados?
What I would say, Peter, is that we have identified where persons are. It's across 4 parishes, but remember, we're dealing with a very small number in a very small country. So from my perspective, there isn't a great deal of utility of looking at it from a geographical perspective because Barbados is so small. When you're looking at the entire United States and you're comparing a city like New York and a city like New Orleans, it's a very different scenario where you have epicenters within a very large country. But it's not the same. I don't know if you wanted to add to that.
Yeah, well, just to say that from a utility point of view, which I believe the Chief Medical Officer has already answered, there is among persons a level of curiosity that serves no value. The persons who need to know where people are the officers who are responding with respect to contact tracing and follow-up. What is the utility of the average Barbadian knowing that there are 2 cases in Christchurch? What is the value of that? It does not detract from the message that we are providing to Barbadians on how to protect ourselves and themselves from the disease. Observe the principles of physical distancing. Observe the principles of hygiene in respect of coughing and sneezing. Observe the principles of hand washing. Those are the things that Barbadians need to know and invest their time in.
Okay, we have a question here from, I believe, a Velda branch. Can you assure us that persons who have been asked to self-quarantine are remaining at home? I believe, Dr. Bess, you were touching on this earlier in terms of some problems you seem to have been exhibiting or experiencing with persons who were self-quarantined, if I'm not
Well, we don't have any reports, so let me explain that out of the 26 cases that we've identified, we have 199 persons who are in home quarantine, and those persons are in home quarantine because they were discovered through contact tracing, which is a very meticulous process that we have to go through to be able to contain the spread of this virus. The process of contact tracing is governed by teams in the polyclinics, and we're utilizing all 9 polyclinics, of course. So if you are a case in a particular catchment, the public health team from that particular polyclinic does the contact tracing. So whether it's in a person's home, person's workplace, social environment, and part of that is daily monitoring of persons to see who's developed symptoms and ensuring that they adhere to the guidelines that we have set for them. They're not to leave their home while in quarantine.
Okay. We had also heard about, unless you want to make a point?
Well, only, I mean, I've had reports of individuals who were asked to self-quarantine, who've been going about to various places. I have a report that a person who was asked to self-quarantine showed up at court. It is irresponsible for any person who has been given the opportunity of being in self-quarantine to be so callous about other people's health. Self-quarantine is not something that you're entitled to. It is an option that we've given you, in part because we hadn't fully built out our quarantine facilities, but also in part because it has become I think it's become an international protocol that some people, if they're not showing symptoms, you allow them to go home and you check on them regularly, and if they show symptoms, then you move to the next stage. It is a privilege to be able to self-quarantine, but people have been misusing it, and I wish that we could assure Ms. Branch that people have been staying at home, but I don't think Minister Bostic or I or anyone at this panel can give you that assurance. I will say, though, that having had some reports of people who are supposed to be on self-quarantine going out and about, as part of our legislative mechanism that we're engaging, we are ensuring that we have the lawful authority to impose a mandatory quarantine on you. The Chief Medical Officer has always had that responsibility, but we are importing it into this current regime so that we have the lawful authority to put you in quarantine at a facility.
But you can still do things, AG, like exercise, walk and run for a particular period?
I'll let Anton handle that.
Can you go to a house in Britain? They have allowed it, but I mean, we are a sovereign country.
So you're allowed to do activities that do not bring you into close contact with other persons. All right. So definitely, if you have a garden, for instance, you can go outside into your garden. You can go outside onto your patio. Those are the kind of activities that we allow. We still recommend distancing within the household. So if you have 5 persons within the household, we still recommend some level of distancing within the household. But there's one distinction I wanted to make. The quarantine that I was referring to was of contact, so actual persons who have been diagnosed with COVID-19. There's another quarantine that we were doing over the last 2 months prior to our very first case on the 16th of March, which is persons traveling from high-risk areas. And those persons we recommended to stay in home quarantine for a period of 14 days from the time that they arrived. And we did have some 1 or 2 instances of persons not adhering to the quarantine, but by and large the adherence and the compliance to quarantine recommendations from the public health officials has been very good.
Well, and I would like to add that because this is a very serious matter as far as I'm concerned, and I have already engaged the services of the Royal Barbados Police Force to be able to locate such persons with the intent, and I want to make it clear, if persons breach this protocol, you will be placed in mandatory quarantine apart from whatever else the legislation provides for, because you are putting others at risk, you are acting irresponsibly, and we believe that in a situation such as the one that confronts this nation, that all Barbadians must act responsibly, all Barbadians must take responsibility for helping us to be able to overcome the challenges, and I would like to urge persons to desist from doing that. And also, let me add that the time will come when home quarantine, certainly for persons who may be asymptomatic, may be a thing of the past if persons continue with this kind of behavior.
AG, what are the penalties for flouting the regulations at the moment under the shutdown?
Well, there are 2 things. First of all, if you breach the quarantine requirements, you are liable to be fined $5,000 or to be imprisoned for a year. Now, we think that that is a significant fine against anyone. But in terms of the curfew requirements, if you breach any of those requirements, you are liable to be fined as much as $50,000 or imprisonment for a year as well. And the curfew requirements may go beyond individuals, and therefore we needed to have a somewhat higher fine structure, while the quarantine requirement is a personal thing. So in that instance, it's a $5,000 fine.
Do you see it reaching the point where you will have to perhaps have on-the-spot fines?
Well, those are things that may happen in other jurisdictions. In Barbados, that is not known to our legal system except in relation to parking tickets.
I would say, for example, I was in town today and I was observing as a journalist. I saw 2 establishments and I saw members of the Royal Barbados Police Force, and I must give kudos to them. They entered 2 establishments where they had in over 25 people, and they consulted the owners, and they shut them down. They told them this cannot continue, and I was amazed. The policemen, they aren't playing.
Well, and it's important that all citizens recognize the importance of social distancing. Let me say, so that we're clear, we do not have a restriction of 25 people in relation to a business. And let's take you back to the first limitation we had. It was that no more than 100 people could be gathered at something that was non-essential, so sporting, recreational, fete, those kinds of things, okay? It was no more than 100 people. We recognized that the illness had the potential to spread rapidly, and we reduced that number to 25. So restaurants couldn't have more than 25 people in them. You couldn't have more than 25 people at a social event. The police intervention would have been an intervention to ensure that there is adequate social distancing within the enterprise, rather than ensuring that it didn't have more than 25 people.
Okay, we're going to take a short break and we'll be back in just a moment. Welcome back to our discussion on COVID-19 shutdown with Honorable Attorney General Dale Marshall, Health Minister Lieutenant Colonel Jeffrey Bostic, Chief Medical Officer Acting Dr. Anton Best, and the COVID-19 Czar, Mr. Richard Carter. Mr. Carter, you wanted to make a point?
I do want to get to, I know we've been discussing a lot around the restrictions and so on, but I do want to get to the point that we have been mounting a whole of government, in fact, a whole of society response. And while there's been a lot of discussion and focus around the restrictions that relate to the imposition of the curfew and the restrictions attendant on the legislation that was just passed through Parliament, I want to remind Barbadians that there are a lot of things that are going on behind the scenes that relate to our attempt to manage the epidemic and to manage the opportunity for the spread of the epidemic. During her wrap-up comments on the estimates, the Prime Minister announced a range of measures that are destined or guaranteed or intended to support the most vulnerable in our society. So there were, for example, the introduction of a 40% increase in the rates that are going to be paid by the Welfare Department. The 1,500 most vulnerable families are going to be identified through a scientific process led by the Welfare Department and the Ministry of People Empowerment and Elder Affairs. And those 1,500 families will receive $600 per month to support them in these particular times when the challenges that they may face in terms of their own maintenance may be greater than they can manage. We have announced the Adopt a Family program, or the Barbados Adopt Our Families program. And we've encouraged Barbadians of high net worth or above average net worth to contribute basically to this, to allow us to support those families that may be vulnerable. And there is going to be the distribution of care packages to 3,000 vulnerable families in Barbados. All of these things intended to support persons who will be vulnerable, because we've constantly and consistently made the point that the resilience of the country, the safety and security of the country extends only so far as the least resilient or the most vulnerable among us. And if we do not extend the hand to protect those persons, we are at the same time removing that hand of comfort and support that will protect us ourselves.
Okay, we have a question here from a farmer. Are places that sell livestock feed allowed to open? AG?
We've determined, obviously, that agriculture is important. So we've provided various exemptions in terms of farms, so as to allow farmers to go into their land and deal with their animals from a much earlier period of time than other enterprises. We've also exempted feed manufacturers from the curfew, so it will still be possible for people who have livestock to access animal feed.
Okay, I want to answer a question before we go to the lines. Lieutenant Colonel Bostic, have there been any cases or suspected cases of COVID-19 at the QEH or primary health care facility, any of the district's hospitals, or the geriatric hospital?
That's a simple answer, no. None that I am aware of, no suspected cases within our institutions. And I can say to you that we have been trying really hard to ensure that we isolate those facilities, try to keep the virus out of those facilities, because we know exactly what is at risk here, especially the geriatric facilities. And that is why we are expending efforts, financial and other resources, to try to get some other facilities set up around the island, some of them in collaboration with the private sector.
Okay, I think we have to go to the lines. Good evening.
Good evening.
Pleasure having you on the line.
Hello?
A pleasure having you on the line. Could you pose your question, please?
Hello?
Yeah, we can hear you loud and clear.
Okay. My question is to Minister Marshall. I just hear him say village shops. When he said village shops, what he mean? Because I'm getting a lot of different views on this question of closing down from 8 to 6. Because my daughter, she have a shop. She pays her mortgage through the shop. And other people tell her that she will be closed for 2 weeks because of this statement.
I'm very glad that you called to ask that question. One of the things about governing is that we have to make sure that whatever we do responds to the needs of the people. In rural Barbados, individuals still go to shops to buy groceries. That is a simple fact. And therefore, it would have been ridiculous of us as an administration to allow supermarkets to open and mini marts to open, but an individual who lives in a district in St. Lucie or St. Joseph or St. George is deprived of the opportunity to walk 150 yards and access similar goods. So let me make it clear, ma'am. When we say village shops, we mean village shops. We mean the shops that we've all grown up accustomed to, where we bought our groceries on a Friday evening or whenever payday was. We mean village shops. And I don't know how else to explain it. We are careful not to say rum shops. We are saying village shops, which may also sell rum, cooking oil, corned beef, sardines, flour, all those things. Those are the enterprises that we want to reopen because individuals in rural Barbados have to have easy access to food.
And,
I hope that's helpful.
Yes, and AG, obviously, you made the point about distance. What would be the point of making someone who lives in Pike Corner, for example, travel 15 miles in order to access a big supermarket when in a ZR, when there is a shop that is open in their village selling the very things that they need? So yes, by shops, we mean shops.
Now, we have seen in England, the Prime Minister Boris Johnson, he's tested positive. The Health Secretary, Matt Hancock, the Chief Medical Officer, Chris Whitty. We've seen Prince Charles, we've seen Justin Trudeau. I want to localize it. Here in Barbados, have any cabinet members or members of parliament been affected by the virus? Have they had tests? We have two of you here.
I certainly have not had any tests. But I can say to you, though, Peter, that I work in an environment and I have a responsibility where I am quite aware that there is an element of risk, but I have to manage the risk. And personally, I'm not going to expose myself unnecessarily, and I think that would go for any cabinet member, but we have a duty and a responsibility to do what we can to keep Barbadians and Barbados safe. And that is really what it is all about.
And we saw MPs observing today, while the discussions were going on, that you were sitting at every other seat.
Well, you know, I have to say that the public noticed that we were physical distancing today, but I've got a few messages saying that we aren't quite physical distancing in your studio. So I have to chastise CBC for bringing us together in such close quarters. So next time, please make sure that we're spread out a little bit more.
Okay, we do have a call on the line. Good evening, you're on the People's, sorry, not the People's Business, you are on Newsnight
This
Special.
is the people's business.
Discussing the People's Business. Good evening.
Hello, good evening.
Yeah, we can hear you loud and clear. Go ahead.
I have a question in regards to the essential workers. If it is that you have to be collected after 8 o'clock or dropped to work to get to work, in my case, the hospital, which I finish work at 9 or I start at 9. If my relative is found at the road after the 8 o'clock, what in that case, what would happen?
Is there a mechanism put in place so that they can show?
Let's make the point that government and regulations have to be sensible and they have to be sensibly applied. Individuals are expected to follow the law without doubt, and the Prime Minister served clear notice that we are not playing on this issue. I will say to you that as a citizen, you have an obligation to follow the rules. As an employee at the hospital, you are personally exempted from being from the restrictions. So you have the right to be on the road morning, noon, or night. I can only urge you, ma'am, with the greatest of respect, to arrange your business so that individuals who are close to you don't run afoul of the law while you yourself are exempt. I can't offer any better advice than that. I understand the difficulty. We have to expect that we're all going to be reasonable in these circumstances. But the fact that you are working at the hospital and that a relative is going to pick you up, I'm afraid that we can't begin to say relatives and friends who are picking up essential workers are exempt. Because then you will end up with 300 or 400 people on the road, and they will all be saying, I'm going to pick up my sister or my wife or my daughter from the hospital. I'm afraid that we can't manage the system that way.
Well, you're at it. We have a question. Should gardeners at hotels and villas go to work?
We've had representations made to us. And in instances where the regulations we've crafted it does not make it clear, or if there's something that's been left out, we're happy to consider it. Businesses are closed. That's the beginning and the end of it. However, hotels, villas, and rental accommodation, by virtue of what they do, are allowed to be open. Okay? And they're allowed to be open, so that means that they have to have some kind of housekeeping, they have to have some kind of maintenance, so they have to have some kind of support staff that are present. At the same time though, and no doubt I guess gardeners and so on are going to be support staff, but at the same time we are going to insist that hotels and any business that has the benefit of the exemption scale back the number of people who they bring to work. So if we give a big supermarket an exemption, it doesn't mean that we are going to be happy that they can show up with all their staff as they would have outside of the curfew. We've met with the social partnership, we've made it clear to all of them. You have a duty to scale back your operation. And therefore, we're going to have to say to hotels and villas, your gardens are going to have to get a little bit overgrown for 2 weeks. But better for you to do it than for us to have to come and regulate it for you.
Okay, there's a situation emerging and it's calling for governmental intervention where some workers are being told that they should take vacation during this period. And we are in a public health emergency. As you know, if they are being told to take vacation, this is illegal, inconsistent with the Holidays with Pay Act, Chapter, I believe, 252 of the laws of Barbados, whereby 2 weeks' notice must be given before proceeding on
14 days.
14 days, correct. 2 weeks.
I just want you
what are you saying to those?
I'm happy that you read it.
Yes, what are you going to say to those employees and to those employers?
You know, the law is the law, and it must not be mocked. Under our Holidays with Pay Act, an employer cannot send an employee on vacation without giving him adequate notice. So when an employer says to an employee, I want you to take vacation, that employee has the right to say no, plain and simple. I'm not here to give people labor law advice, but that is the effect of the law. We have not amended that legislation. Now, let us be reasonable though. Let's be reasonable. I know of some in some places where employers have said that individuals have 100, 120 days vacation accumulated. So if an employer says to an individual, I want you to take vacation, there should be some spirit of compromise if you have that flexibility. It would be better for the economists to have come tonight to say this, but the fact is the Barbadian economy is going to go through some very difficult times for workers. It's going to go through some very difficult times for businesses. And, you know, we're going to have to come together to help each other to survive this process. Employees are going to have to give a little. Business owners are going to have to give a little. The bottom line is that any employer who insists that a person goes on vacation is in breach of the law. But at the same time, I'd like to urge that if there's some flexibility, an individual who doesn't mind taking the vacation early, an individual who has a lot of holidays stored up, there's room for accommodation. But beyond that, it is wrong to say to an individual, you have to take your vacation now.
Because you can't negotiate outside of the law.
Exactly.
Okay. I want to ask a question pertaining to young people. There have been at least 3 cases have emerged worldwide. There was a case where a guy, he's 17, died in the United States in California. And last week they said he was perfect. No underlying health conditions. COVID-19, bam, a week later he's dead. One in Louisiana, it was 19, and then a young lady in UK, 21. Our young people somehow feel they might be invincible, but this is a serious thing affecting all colors, classes, creed, races, young, old, middle-aged. It seems that this is a very serious public health problem. Your thoughts?
Yeah, so what I would say is that you're absolutely correct. COVID-19 is unprecedented. This is a very, very serious illness that we're dealing with. We do take some comfort in the fact that the case fatality rate is lower in the younger persons, and this has caused a problem because we're communicating this as a fact. This is what we're seeing, that the case fatality rates tend to be higher in persons who are over 60 and persons who are over 70. We did that without consideration for the message that we're sending, which is that young people are immune. We don't want to get that message over because that's not true. Young people are simply not immune. The likelihood of death as a young person is substantially lower. The other thing to consider is young people are people that can pass on the virus. So we don't want them to be partying. We don't want them to be not understanding the importance of physical distancing and still doing it. Because even though you're less likely to die, even though you're more likely to have a mild infection, you can pass it on to other people. You can pass it on to your parents. You can pass it on to other friends. You can pass it on to your grandparents. So we have to get the message out there that you have to pay attention and to heed the warnings that we in the Ministry of Health and Wellness and the wider government of Barbados are advising to everyone.
And the age issue, Peter, is an issue that we have been obviously particularly concerned about. And a young person who gets a mild form of the illness or may even be asymptomatic, who transfers that infection to their parent or grandparent is putting them at risk, but also exacerbating a situation where we have seen in many parts of the world where elderly persons are most likely to require invasive or serious medical intervention. Now, we do have limited capacity in terms of treatment of persons who require very serious and advanced medical treatment as a result of contracting COVID. We could potentially see an explosion of those cases if we see the continuation of that reckless behavior among young persons. And we have seen it in many parts of the world. We've seen very tragic situations where governments and states have had to make the decision as to who gets a ventilator and who doesn't, simply because the healthcare system has been overwhelmed. We've seen situations in Spain, I believe, where elderly persons were found dead in their beds, abandoned as a consequence of the fear and so on that persons have witnessed, which is one of the reasons why we have actually embarked on a program, and this is an additional thing that will be rolled out, to support persons who are 70 years and older. And I want to say to Barbadians that the government of Barbados will be, through its officers, contacting those persons in Barbados who are 70 years and over with a view to identifying whether or not those persons have adequate levels of support in terms of getting groceries, in terms of getting their medication, because by all means we have made the call consistently to try to restrict the exposure of that population to engagement with the public. So I'm using this medium to basically say, expect a call from an official identifying themselves clearly as a representative, as an officer of the government, inquiring about your capacity to exercise the level of independent living that is required over the 2 weeks, and if not, to offer the support of the government in terms of meeting the requirements of getting groceries, getting medication, and so on.
Okay, I have many questions, but I want to involve the public more, so I'm going to go to the phone lines. Good evening.
Hi, good evening.
Go ahead.
Hi, yes. I have two quick comments, one for the AG and one for Dr. Beth. AG, listen, I heard the Prime Minister last night say that tonight all will be made a little clearer. I have to say to you that it is not very clear, and I'm a reasonably intelligent lady. You seem to start by saying all businesses will be closed with the exception of essential services. But I think the wider public is still confused as to what you're really saying. I feel like you should just be very frank and say, listen, if I am closing for the coconut vendor, it's not going to happen, you have to stay home. This is for the sacrifice and the good of the general public, and I need you to stay home for 2 weeks and make that sacrifice. Yes, you might not be able to make the money, but I need you to just stay. The only person that seems to speak with any sharp clarity so far tonight is the Czar Carter. And Dr. Beth, I'm very confused by you saying that you have not tested your frontline workers because the situation in Barbados is not dire. The reason why the situation is dire in the UK is because the frontline workers weren't tested. Are you thereby suggesting that you're going to wait until they get sick to test them? I think all of them should be tested, all the doctors, all the nurses, everything, to make sure that it's okay before it gets to that stage.
Okay, thank you very much. Some very interesting observations there, AG. And then we'll go to Lieutenant Colonel Bostic.
I'm happy to repeat. In the period of the curfew from Saturday night at 8 until the 14th, it is the intention of the Barbados government that all enterprises will close, but there are exceptions. And the caller referred only to essential services. Essential services are statutorily defined and highlights those services like police, security, water, light, those kinds of things. Those are going to be allowed to operate 24/7 because they are the essential services to keep Barbados functioning. Okay? But of course, you cannot buy food from a policeman. You cannot buy pharmaceuticals from the Water Authority. So we've decided to make a number of exceptions. And those exceptions are intended to allow Barbadians to survive. Those exceptions are generally related to the day-to-day things that Barbadians must have. Now, I've outlined some of them. Bakeries, farms, pharmaceutical farms need to function because we need people to slaughter chickens. We need farms to function. We've asked the Ministry of Agriculture to immediately plant 750 something acres so as to ensure that we have food security. Banks and credit unions, Barbadians need to be able to get money to be able to buy medicines. Pharmacies, okay? So Barbados will itself be open to a limited extent. Now, we recognize, though, that at this point in time, there has to be some give and take. There has to be an opportunity for the establishment, for the government to create exceptions and to add on people where necessary. And that's the only issue. The caller is asking me to say exactly who. We've outlined a list. I believe by now that list should have been published by GAS. But we're saying, so for example, customs brokers have to be closed. But if a shipment of ventilators comes into Barbados, we have to allow customs brokers for that limited purpose to go and clear them. So they're going to get an exemption for that limited purpose. I've pointed out Harrison's Point. Again, an exemption for the limited purpose. So in managing anything, we have to always remember that there has to be opportunity to be flexible.
And the lady did say about the frontline workers, if a BDF worker is going into war, they go with a gun. If a policeman is going into a battle, they go with a pistol or baton. They're saying if the frontline workers are going to fight this COVID-19, they need to be tested.
They go with personal protective equipment.
PPEs.
That's what they go with.
Exactly.
So I should have made it clear that we have tested healthcare workers in which there was a suspicion. But at this current point, we don't have any evidence to suggest that there is any community spread. There's wide community spread. And we certainly don't have a situation where we're picking up cases in our clinics and in our hospitals. So we're not at a stage where we have a reason to test healthcare workers. And you're simply not going to get much value out of testing somebody who's asymptomatic, full stop. So if we ever got to a situation in which there's wide spread of COVID-19 across Barbados and we're seeing a lot of cases in our healthcare institutions, then the circumstances are going to change. That's all I'm trying to say.
Anyone can hazard a guess or give us an estimate as to how much community spread there is at this time?
No. I would like to believe that the 26 persons that we've diagnosed so far are 26 of a very few. just a few that we're missing, but it's entirely possible that there are many, many more people out there who have COVID. We just haven't detected it yet with our surveillance systems. But we're constantly looking. We've changed our guidelines in terms of the criteria for testing. We're paying very close attention and monitoring as much as we can.
Okay, we have another call on the line. Good evening.
Hi, good evening.
Go ahead, ma'am.
I am calling because I am a healthcare worker. Let's say if I finish work at 7:30 and we don't have public transportation in our area running at that time, and I have someone to come for me and he can't come, how will I be able to get home?
Interesting question.
I don't know what time the shifts are at
The thing is, we are looking at all of these matters in relation to shift changes, location of facilities, and the kind of facilities that will operate, late hours, obviously the hospitals in particular. And the Queen Elizabeth Hospital, for example, already has in place a system to take home workers depending on the time of the shift. Even the 24-hour service, we've had to put some things in place. And so I will be meeting with the head of these institutions so that we can ensure that no healthcare worker is disadvantaged, recognizing the need for the healthcare workers within the facilities.
Okay, so in Britain they had a situation like that, and I think it was Ibrahimovic, he came to the rescue with Chelsea offering their hotel as a place where the frontline workers can stay, but that's a whole different scenario. We don't have those resources in Barbados. I want to ask, how difficult is it for the families of those affected, especially not being able to visit them, and what support, if any, is being provided for those affected and by extension their families, or has this aspect not been factored into the equation at all?
So what I would say is that out of the 26 persons that we currently have in isolation, we have had some challenges. For instance, we are paying attention not only to the physical health of those patients, but we're paying attention to the mental and emotional health as well. So when necessary, we have had to call mental health services to be able to provide mental health counseling for persons who are depressed or suffering from mental ill health. So that's something that we've paid close attention to, and if the situation ever warranted in terms of the families, we would do what we can, certainly from the point of view of the Ministry of Health and Wellness.
Okay, we have Mr. Ronnie Quimby. He's saying, should organizations which provide communities with essentials such as food, items, or meals discontinue for this specific time period?
We've been careful to consider how the least advantaged in our society will be cared for, and we've therefore made sure that caregivers are included in essential services. We also include the welfare department so that they can go out and deal with things. A number of agencies that provide food, feeding programs for the homeless and so on, they have reached out to us during the course of the evening, and they have asked if they could be exempted. There are individuals who will fall through the cracks, and we have to find a way to support those, and we'll be giving active consideration to providing those institutions like the Salvation Army and those kinds of places that have active feed programs to continue those programs, because that is what being humane is about. And yes, we could easily say that this is a black or white situation, but life is not black or white. And we're going to give every opportunity. We're an entity, has an established program of supporting the needy. We're going to allow them to do that. But at the same time, we're not going to allow the Kiwanis Club and the Rotary to carry out their programs. A feeding program is an essential part of what happens in Barbados. And if we say that we're going to make sure that households can get food, then we also have to say that we are going to maintain programs to keep those people who don't have that support structure taken care of.
Okay. Sorry, Peter, just to expand very quickly on what the AG said. I already spoke about our intention to distribute care packages to those households that are most vulnerable. These care packages will contain essentials required to basically live over a 2-week period, and those care packages will be distributed to over 3,000 families in Barbados. I myself witnessed the process of preparation of those packages this afternoon. We already have a couple hundred that are already prepared, and we are basically aiming to 3,000.
Okay, I believe we have a call on the line. We have a call on the line. Good evening.
Hello. Yes, hi, good evening.
Go ahead, ma'am.
Good night to the panel.
Good night.
My question is for the AG. When you say essential workers, what about a person considered as a general worker that works in MTW, that works just patching the road? Or what about a janitor that works in schools and schools are now closed, or like school meals? Are those considered essential workers?
I'm afraid not, ma'am. Those are not essential workers. Those individuals will not be required to go to work. Can I say, Peter, that there are two things, and I know time is running, so let me try and make these 2 points.
We have a lot of questions.
Let me try and make these 2 points, okay? The government has sat down as an entity and determined that some government departments are going to be priority. Other government departments are not going to be priority. So those people will have the opportunity to work from home if they can, or they will just stay at home. Departments like welfare and other departments like that, there's a long list of them, are going to be expected to show up for work, but with skeleton staff. Where possible, individuals can work from home. MTW is not part of that construct, and therefore MTW workers, if they can work from home, they will. If they can't work from home, then they will just be at home.
Well, you had it. Go ahead, Lieutenant
To
Colonel.
be absolutely clear here on this point, though, I think it has more to do with essential services or workers of essential services, because the hospital is an essential service. Therefore, a janitor or a general worker working in the hospital is essential. So I just wanted to make that distinction.
Okay, we have a call
Absolutely.
saying, how will public transportation operate? What are the hours, and has the number of passengers been restricted?
We have not yet made a decision to restrict passengers in public transport. I think that discussion is going on. The Prime Minister has met with the Transport Authority, and I think that whatever, as I understand it, their plan is either now about to be finalized or will be finalized within the next few hours. In relation to transport services, well, people have to be able to move about, and for that reason, we have exempted transport services. In fact, in the regulations, we are treating transport services as being an essential service. But let's go back to basics. Services transport people. People are going to be off the road at 8 o'clock. So there's nobody for the transport services to transport in the ordinary course of things. Now, there's going to be a limited number of people who work in essential services who will have to be moved about, and we still have to please a reduced number of vehicles on the road at this point in time.
That's a very interesting question. I want to pose this to the panel. Have all healthcare professionals who care for patients been asked to desist from wearing their uniforms to and from work? That a case in Jamaica where the nurses are being left on the roadside. There is a perception that they're helping to spread COVID-19.
So I've been asked this quite a few times, I believe, on the last two appearances on your show, Peter. From an infection prevention and control perspective, we simply do not factor in the wearing of uniforms on the streets and then in institutions. It's simply something that isn't a consideration because you're not increasing the chances and likelihood of bringing something in like COVID. COVID is spread through respiratory droplets. The spread therefore can be reduced by hand hygiene, basic hand hygiene. And those are the practices that we instill in healthcare workers in institutions. I also would have made the point previously that, if you're looking at the uniforms or clothes that persons wear, healthcare workers wear, then you should also consider what happens with visitors who are coming in and off the streets, although that point is relatively moot now that we've shut down visitations to healthcare facilities. So I just want to assure the person who's asking that question that there are healthcare practices that are always in place to reduce the spread of contagion such as COVID-19. And wearing of uniform is not one of them.
Another question here, what provisions are in place for people in areas that regularly experience water outages?
And that's critical for us. We're telling people hygiene practices. So we're saying wash your hands often. It is the reality of much of rural Barbados, and especially St. Joseph. I have a feeling that rural resident is from St. Joseph, where we are constantly experiencing shortages of water, but we are still expected to play our part in the fight against COVID. Now, the Ministry of Responsibility for Water and the Barbados Water Authority has been directed to do a number of things. They've been directed to increase the number of community tanks that are installed in rural Barbados and the hard affected areas immediately. They've been directed to try to look to provide hand sanitizer and other sanitizing supplies for individuals in those hard hit areas. They've also been directed to procure supplies of water in jugs or in large bottles, whatever you call them, to the residents of places like St. Joseph and so on. So the Water Authority is actively engaged in making sure that to every extent possible, if they can't increase the amount of water that comes to you through your pipes, they're putting those other arrangements in place, and those are actively being worked on as I speak.
A question here, many of us are wondering why have the borders not been closed, even if only for the duration of the curfew? If our cases are mainly imported, why does it make sense to leave the borders open? Lieutenant Colonel?
This is a question that has been asked for the last several weeks, and as I would have indicated several weeks ago from a public health perspective, we have been operating under the conditions established by the World Health Organization, and it is stated that closing borders do not stop the virus from coming in. And if we look across the globe at several countries that have done so, that has not happened. In the case of Barbados, I made it clear that we were still in the process of receiving items of equipment and food because we depend a lot on things being imported into Barbados. We felt and still do feel that surveillance at ports of entry would have assisted us in this effort, and as flights and cruise ships arriving in this country have scaled down, we have taken appropriate action, and also by targeting flights coming into Barbados from countries of interest. So as the virus escalated across the globe, we've had to take other measures, and that is where we are today.
Peter, if I may add to that, just to reiterate the point that the Minister made, we have to follow the science. Anything that we do in public health, any recommendations that come from us to the Cabinet of Barbados have to be based on evidence. And just to repeat, there's no evidence that this is an effective intervention. One of the points I also wanted to make is that we do have a number of imported cases, but those imported cases are persons who reside in Barbados who traveled overseas. The assumption about closing the borders that people make is that you're stopping the tourists from coming from areas that are heavily affected. People aren't thinking that it's actually persons who live in Barbados who travel. It's a reality that we live in the world that we live in, that people do travel.
Okay, AG, you want to make one quick point?
Yes, there was a caller earlier who identified herself as being a general worker at the Ministry of Transport Works and Maintenance. I've just been informed by a senior member of staff there that a memo actually went out today to all of their staff, identifying them that the usual work hours of the ministry have been changed, and the MTW workers will now work from 9 until 2.
Okay. It's that time. I'm going to give each of you 30 seconds to leave a message with Barbadians as we fight COVID-19. COVID-Czar, Richard Carter.
Let us follow the advice that has been given by the public health officials. Let us trust in the science that we've been following. Let us show empathy, compassion, and responsibility. And let us respect life.
Okay, final thoughts, Dr. Anton-Best?
Sure. It's been under 2 weeks since we started. Our first case was the 16th of March, and this is now, as of the 26th of March, we've moved from stage 0 to stage 3. So we're at this moment where this is the fight of our lives. And the key message is, I want to leave a message that we can never get tired of saying or get tired of hearing, is that respiratory hygiene is imperative. We have to remind people not to go to clinics if they have respiratory symptoms. You must call ahead. You can also call our hotline at the Ministry of Health, 536-4500. And hand hygiene is absolutely important as well. Hand washing for 20 seconds and the use of alcohol-based hand sanitizer.
Okay, final thoughts, Dr. Mr. Bostic?
Dr. Bostic.
No, my final thought is to assure Barbadians that the Ministry of Health and Wellness, in all of its manifestations, will continue to do our very best to keep this country safe from COVID.
Final thoughts are yours,
For
Attorney
me,
General.
I'd just like to say that this is going to be a difficult 2 weeks for us. I imagine that the last time Barbados had any kind of curfew would probably have been at the time of World War II. There are not many Barbadians alive who would have experienced that. But it is for the good of our society that Barbadians comply with the restrictions. And I hope that, and I'm sure that at the end of this whole process, we will emerge from it being a more resilient people and being more responsive to each other and being certainly more humane.
And I want to thank you four honorable gentlemen for coming here. And Barbadians, as I leave you tonight with this discussion on COVID-19 shutdown, I have one central message to leave with you. In light of the first announcement on March 17th of 2 reported cases, and since then, as you know, it has jumped to 26. The virus isn't spreading in Barbados. It's the people who are spreading the virus. Kindly adhere to the requests of the health officials in whom we have put our trust. Good night, and thank you.